News now from Bangladesh, where its worst dengue fever outbreak on record has killed more than 300 people this year. The spike in new cases has overwhelmed the country's vulnerable medical system and prompted calls for a better coordinated response. We tell you more in our next report.
An unending abuse of the environment, polluting and violating at will, comes back to bite. All of South Asia has felt the dengue onslaught post-rains hard on a regular basis. Bangladesh has scaled an unwelcome new peak this year. This rainy season alone, the death toll in Bangladesh was recorded at 303 as of the 6th of August, way beyond the 283 in 2022, making it a record set for 2 successive years. The number of cases reported at some 63,700 is up nearly eightfold from the year 2000, when tracking of the mosquito-borne viral disease began. And it shows on the ground, in hospitals bursting at the seams. Major public hospitals have been asked to add hundreds of beds for dengue patients. The influx of patients is a near constant.
Since we came here, the doctors and nurses told us that they cannot provide us with a proper bed, but if we stay, they would treat us. We had no other choice but to arrange things on the floor for my mother and sister.
My son works on a cargo ferry. When he got sick, his boss admitted him here and called us. I came from the village to take care of my son. Today is our 4th day in the hospital.
Authorities say the peak has still not arrived. The government has launched a series of awareness campaigns, now an annual effort that picks up with the rainy season when the threat is at its worst. Encouraging use of mosquito nets, reducing water accumulation and stagnation around homes and public venues. Wiping out mosquito larvae are big focus areas. Besides advice for protection of school children, like all-covering clothing. Researchers have warned that the peak of the dengue outbreak in Bangladesh is yet to come. Aedes mosquitoes, the species that transmits dengue and Zika, start a breeding burst during the wet season. As the rains ease, they move into urban areas in search of water with the virus they carry.
When the pre-monsoon rains started in April, so did the Aedes mosquito breeding. The virus had already spread within the community, therefore it was also being transmitted. This is the reason why we are seeing such a high number of dengue cases in July. This will probably increase further in August and September.
The annual spread of dengue in Bangladesh and several countries in South Asia has highlighted the need for prioritized and electronic-based surveillance and targeted interventions. Surveillance, awareness, training and engagement programs that gather speed during the rains cannot remain a part-time plan. The numbers themselves, the new casualty records, spell out that the region can ill afford the neglect.